Hi, my name is Herb Eit. I'm an orthopedic surgeon at Hoag Orthopedic Institute. And today I want to talk about stress fractures, the risk factors, and also prevention of stress fractures in young athletes. Some of the most common risk factors, younger age. So when athletes specialize at a younger age, that's an important increase in risk for stress injury to the bones and stress fractures. In addition, young girls are more prone than young boys for stress injury. One of the biggest causes is a sudden change in training regimen, and history of previous stress fracture is an increased risk. People with bone mineral density problems and training factors such as technique or biomechanical factors can influence risk factors. The most common sports that cause repetitive stress injury, bone stress injury, and stress fractures are running sports. So cross country and track are some of the most common, but any running sport, field sports such as soccer, lacrosse, and football are very common, but they have to do with overtraining as well as changes in the training level. And that's an important thing to recognize as a risk factor for stress injury. So how much training is too much training? It's clear that more than 90% of stress fractures are found in people with more than an hour per day of training, but different people can do way more than that but still not have fractures. And what influences that? There are many factors that influence it. The prevention of bone stress injury and stress fractures, there are important things you can do. The first one is managing your training level. Quick changes in the intensity of your training are a risk factor, as we talked about, but managing that and being aware of your training level and increasing slowly is a key to preventing it. Another thing that is important is not specializing in one sport, but also strength training to augment that sport that you love. So you can, outside of the season, but also in addition to the sport, working on strength does decrease stress injury to the bones. There are people that have medical factors, and that's important to work with your doctor to identify risk factors that will influence bone stress, and managing that with medications or other treatments to improve the risk of bone stress and prevent them. Another thing that is very important is the awareness about bone stress injuries. Your coaches and your parents need to understand that these are possible injuries, and recognizing them. If there's pain that's unrelieved by conservative measures, seeking out your doctor's advice and having a high suspicion for that is important.